Hello guys, welcome to my first YouTube video. My name is Mia. I just wanted to share a little bit about my cancer journey. So, I have metastatic follicular thyroid cancer that is radioactive iodine resistant. And I was first diagnosed in 2018. And let me tell you a little bit about my diagnosis story. So, since I was a child, I've been prone to ear infections. I got little ears, as the doctors say, and I had the worst ear infection that I've had maybe ever. I'm not sure, but I was in so much pain, just inconsolable. Nothing was touching it, and of course it happens like on a Friday. I first go to urgent care on that Friday and see a nurse practitioner. She gives me some eardrops. Nothing's touching it. Then I go to a ER and see an ER doctor, and they don't do anything. They just give me these things that are supposed to help widen the ear to get the drops in, because my ear was so swollen the drops would not go in. And then that still didn't cut it. So then I went to urgent care again. This is all in the matter of several days. I see a doctor, and he finally prescribes me some antibiotics orally, then he tells me to continue using my my eardrops. Well, again, it still didn't work, and so I went to an ENT doctor, and luckily I was able to get in fast. And this ENT, while he's examining my ears, and he is able to give me some antibiotics in my ears, and do a full checkup, and he feels my neck, and he feels a large mass. And this wasn't the first time I had heard that. I've had other doctors say that, oh, your neck feels very swollen. It feels like you have a large thyroid, but I didn't know enough that I should advocate, well, can you do an ultrasound? But this doctor, he got me an ultrasound. And so the earache went away finally, but I went to get my ultrasound. And the ultrasound showed I had a 5-centimeter mass. They call them nodules when it's on your thyroid, and they don't know what it is. So they don't know whether it's they'll call it a cancer or not. It'll be a nodule. They did notice that it was solid, and it didn't have any and it had calcification, and it looked suspicious, like it was cancer. And so then I had a biopsy not too long after. I remember it was Halloween, and the techs and everyone was dressed up, and my tech was Alvin and the Chipmunks. But anyway, super cute, and they gave out candy. I pretty much knew right away, just from their response on the and that from the ultrasound, because it was ultrasound guided with a radiologist who does it. Of course, when we get the biopsy back, it is inconclusive, and they but let me back up. It took a month for me to get it. A month. That is the most torturous thing ever. Ask any cancer patient. That is the worst part. It is not knowing. It's the not knowing where you're just stuck in this limbo. So I didn't know for a month, and then when we do get the results, it's inconclusive. And pretty much every biopsy I've had since then has always been inconclusive, and it's almost like, why do we do this? But we'll get there. So then they, once we got the result, well, they sent it off to genetic testing when it is inconclusive, and it showed I had NRAS, and I think it was just NRAS at the time for our mutation. And RAS mutations are generally associated with follicular thyroid cancer, but they can also be associated with a follicular neoplasm, which is non-cancerous. Anywho, so they work me up for surgery because the only way they're going to know is if they have cut it out. And so I began to do all my research. I research like no man's land. Or nobody's business. I love to research anyway. I just read everything, watched everything that I could about thyroid cancer and the different types. If you don't know, there's papillary, follicular, Herschel cell, and medullary and anaplastic. And then there are some other kind of subtypes that I won't go into there. There's, all kinds. Anyway, the way they had described my tumor was kind of lining up with follicular. So I had an idea that that's what it could be in my mind, even though nobody had said that or no doctor had said that. In fact, most of the first time he said, it's like, barely anybody, it's very rare that this will be cancer. I'm positive it's probably not. And then he's like, then after the mutation, he's like, well, it does say suspicious for cancer, but which was in my mutation report, but it's not conclusive because on a mutation report, it generally doesn't give, well, for follicular, it never gives 100%. And I was like, okay, but that doesn't seem right to me. And then I remember asking him, I said, well, if it is cancer, can it spread anywhere else? Because I knew that a 5 centimeter lung nodule, or not nodules, sorry, mass had been in my neck for a while, if it's a slow growing cancer. So it had to, I was thinking, well, it could be spreading, or have spread. Those little cancer cells, they just need one little tiny little chunk you can't see, microscopic, and floats around, and then bam. And I asked him, can it spread to your lungs? Which I had already knew the answer because I had read that yes, it can. And he's like, oh no, that's very rare. No, it doesn't spread to the lungs. And I was like, I don't think that's right. So then that cued me to look for other doctors. So then I went to another facility, and I wanted to go to the best of the best there. So I was able to get with the best surgeon there, and they did confirm, yes, this looks suspicious for cancer. And the other thing I was worried about is I know that it's in a sensitive area, and so there are a lot of instances where surgeons cut the vocal cords, or either permanently cause damage or temporarily. And in fact, that did happen to my bestie, but that's another story for another day. But so that was the other reason why I wanted a really good surgeon, and I did choose right. excellent surgeon, did a great job. The only thing is I remember when when during my surgery, they bring the patient's family back and they tell them how they're doing and how everything's going, and they're like, "Oh yeah, it doesn't look like cancer." In the frozen section, that they do like a quick biopsy, pathology type thing, doesn't show that it's cancer, so it's probably just a large benign mass. And I wish he hadn't said that, just because in my gut I knew it was cancer. So he gave that kind of false hope to my family, and they were like, "Yeah, it's not." And I knew that follicular never shows up. It can only be diagnosed once it's fully out of the body, and pathologists have time to look at it. And so, so then you have to wait a whole week for pathology to come back and your return appointment. So so that whole week you're sitting there waiting, wondering what it is. And my family's like, "Oh, it's good. You're good." And I'm like, "I don't think that's, something inside me said, I don't think that's true." And unfortunately I was right. So we go to the follow-up. They tell you the dreaded words: you have cancer, and it's follicular, and also it has it shows vascular invasion. And so what that means that it had already spread outside outside of its little contained tumor. So highly likely that it was gonna I was gonna have a reoccurrence. And but they still try to keep you positive, sell it to you like it's a good thing, but you got the good cancer. You got the good cancer, and you'll be just fine. It's gonna, no big deal. But we will. Oh, also, they never take out the full thyroid, and you're thinking, why? Just take the whole thing out, man. There are some surgeons that will, but from what I've seen, that generally, and I think it is part of the guidelines, is that you take one lobe of the thyroid and then you go back and take the other, if it is cancer. If it's not, then you've saved your thyroid. And that's why they do it. They want you to still have a thyroid, because a lot of people can function just fine and not need medication for the rest of their life. Once you have your thyroid removed, you'll need medication for the rest of your life. You would die without it. Eventually your organs would shut down, and it wouldn't be fun, because it is quite an experience to have your, they call it hypothyroid, when your numbers go high. It is confusing for those, because you would think it'd be low, but it's high. So your TSH is your thyroid hormone, and when they if you don't have one, or it's not working well, you're going to have high numbers, and you don't feel good. You feel kind of like you have the flu. You're extremely lethargic and tired, and you gain weight easy. And also there can be temperature issues too, but anyhow, there's that. So after after that was confirmed it was cancer, then we scheduled another date for the other half. And they didn't see on the ultrasound that there was any cancer on the other side, so they didn't think there was. Well, it did turn out there was cancer on the other side. It was very small. And this was actually papillary thyroid cancer. But it did not look like that had spread outside of the body. So we were good there, but because there was cancer on that side, then they wanted me to do the radioactive iodine. So after surgery, then you hold your medication for or you hold your thyroid medication that whole time. So you have to withdraw your cells from the thyroid hormone in order for it to take up the radioactive iodine. And part of this is because the thyroid loves iodine. And so they basically give you a pill that like attaches the iodine to it, or the radiation to the iodine, and then that's what kills your cancer cells. But you also have to go on a special diet, no iodine. So you have to also starve your cells of the iodine. So that way, when you have it, it's hungry for it, and you can just kill off those little cancer cells. Well, I did that, and I think the way mine was, I was off the thyroid hormone for a little bit longer than some folks, but I was, I think it was, I want to say 6 weeks after surgery. So by the time I took the radioactive iodine, my TSH was like 75 or so, and I mean, I could fall asleep standing up. I could barely walk to my car. I was just so tired. Anywho, so I take the radioactive iodine. I secluded myself for a week. I had a decently high dose. I had about 102 millicuries. It was kind of a weird number. It's not as high as some people, but it was high enough they thought would get the job done without causing too much damage, because there are risks. And I will say that did stink. It was on a Friday. My stomach hurt so bad that entire weekend, and I felt nauseous. They sell it to you like you're not supposed to feel anything. It's no big deal. It's easy. You don't feel sick. It's easy peasy. You got the good cancer. And yeah, that was not the case for me. My stomach hurt so bad. I was in tears. But we got through it. And also you have to eat sour foods because you have to keep your salivary glands moving, and you need to hydrate. You're trying to flush your body of that radiation because you don't want it to sit in there, because radiation can cause other cancers. Generally, the dose I had would be if I had it many times, and then even some doctors don't believe it does. However, there are many articles showing it does. And then within my thyroid cancer group, there are many folks that got secondary cancers. So I'm not gonna risk it. But anywho, back to what I was saying. So I had that done, and then they begin to monitor you. Well, the first year we were good, ish. My tumor marker never went down to 0. It lowered that right after I took it, I think, and then it began to slowly incline. But it was slow enough that the first year, no big deal. But then the second year, it had risen enough. They did a whole body scan, which is not a whole body scan is not a PET scan. It is a nuke med scan that they use trace amounts of radioactive iodine. They call it, it's not exactly radioactive. Anyway, you don't need the technical part, but anyway, that did not show I had anything. So they're like, oh, you're good to go. Then, but they still wanted to check my level since it was higher than it had been. In 3 months, we check it again. It had risen again. And they're like, so they did I believe I had a neck CT and a chest CT. At that time, there was nothing in the neck, but they did find a very small nodule on my lung. Well, they gave me the spiel. Well, people in Missouri, they have A lot of them have lung nodules, and this is normal. I'm like, but I didn't grow up in Missouri. I lived in California till I was 30. So I hadn't been here that long. So, but they're like, it's fine, no big deal. Lots of people have lung nodules. Then it was, so that was in February of 2020. And then 2019, August of 2020, after the pandemic, I had, or in the midst of the pandemic, I had, my levels had went up again. And so this time they decided to do a PET scan. A PET scan, if you don't know what a PET scan is, it's my favorite of the scans. It's because you get a nap. But a PET scan will, they will put radioactive sugar in your body, and you sit for an hour, and then it, anywhere there's cancer in your body, it should show up. Now, normal thyroid cancer, it will not show up. Thyroid cancer that takes up iodine still, it won't show up on a PET scan. But if you do not have, if yours is resistant to iodine, then it will show up and it will light up. And they found one spot on my lung. It was my left, I think it was the lower or upper, somewhere. And we found that nodule that they'd seen earlier, and that had grown, and it lit up. And even then, they're still like, it's just one little nodule, no big deal. But I was like, well, I want to, that kind of tells me, then if it is, then we know that then I have metastatic disease. And I would like, then that means they're going to watch me more closely, because at first they were just watching me every 6 months. And the nodule was too small for a biopsy, but concerning enough. And I work at a cancer center and know people, so I was able to get on with the thoracic surgeon, who was wonderful. And he looked at my scans, and he's like, oh yeah, that looks concerning. And he did a wedge resection of my left lobe, which was painful. It may be a simple procedure. Oh, it was video-assisted wedge resection. But it was painful. It was very hard. It was a hard recovery. It was hard to get up. My body, I just did not bounce back well. I was tired for a long time, winded. But I was glad I had it done. Oh, and they took it out, and yes, it was follicular thyroid cancer. And then at that time, they'd sent it to for molecular or genetic testing. So they tested the tumor for what kind of genetic mutations it had, and it had the NRAS, but it also had the TERT promoter gene, which that TERT promoter makes it a little more aggressive. So that right there should tell us, oh, it's going to come back again. So then, not even, so that was in August. So by December, my tumor marker had risen again. They thought it was going to go down. I was going to be all better. Nope, it had risen again. And then they found that I had a new mass in my neck. And it was kind of in my, mediastinum. Well, it was in the mediastinum, the upper mediastinum and neck. And in the, I think there were 2 spots, and in the thyroid bed. So then I went back in for surgery with my first ENT surgeon, or otolaryngologist. I'm not sure if I'm saying that right. But even though I work at a cancer center, found it again. Yes, oh, thyroid cancer. And that one was pretty good size, and that had grown pretty fast because the previous year in January or February it had not, there was nothing. So and it anywho, so then we got that out, and then I went a whole year, and then again my tumor marker kept rising, slow and steady, but always rising. Then another scan showed I had another mass pop up in my neck. And I think that was the time that I got this one and this one. And I had a drain too, which I still have that scar. Yeah. And so that's a total of actually 5 surgeries. Am I up to the 5? Yeah. 1, 2, 3, 4. Yep. Yeah. So 5 surgeries, 4 on the neck and 1 on the lung. And then, anywho, then I was clear, for a little bit. But within that same year, my tumor markers rose again. And then had a scan, and then it showed now it was on a new area, kind of right on my trachea. And it was sitting right on the trachea. They didn't feel comfortable doing a surgery, that it could be that I could lose my voice and end up with a trach. And so they did radiation, and which I have this cool mask. Yep, look at that, looking good. Had that done, and I'll have to post a video of that, because I did record that, and that actually really wasn't too bad, at least the radiation itself. So it's just your initial consults, it's like 30 minutes or maybe an hour, because they have to make the mask and that, but really when you have radiation, it's just 10 minutes a day, 10 or 15. Little machine goes around you, and the techs are always so nice, make you feel like a pretty princess, and then you're done. The end of radiation, though, you begin to feel really tired, not well, lethargic, begin a little bit of trouble breathing, but my throat hurt like the dickens. Like it hurt like if you had strep throat, hurt real bad. Now I was lucky, my radiation oncologist changed the plan. Originally I was supposed to have 30 5 days a week for 7 weeks. I think they call it fractions, doses of radiation, at kind of a lower dose. What he did instead is he went for a higher dose for a short amount of time, and he was basing that off of information studies he found with lung cancer, and I think prostate cancer, I want to say, in that they've found that it's been actually more successful doing it the shorter duration at the higher dose. And head and neck cancer folk really have the hardest part with the radiation, because you can't, many are unable to eat, swallow, and this continues after you stop. You lose your taste buds, all kinds of things. And so I got really lucky that he chose the smaller amount of time, but the higher dose, because it did, even to this day, that spot has not come back. And I also, it didn't hurt my vocal cord. For a bit, I would get hoarse easy after the radiation, and I also couldn't sing. Not that I was a great singer, but I couldn't sing in church. But now it's definitely much better. So I got very lucky there. But anywho, so that was December of 2022 when I finished that up, the radiation. And then my tumor marker went down, and I don't think I mentioned this before, but the tumor marker's name is thyroglobulin, is what it's called. It went down to 13, and then over this last year of 2023, it of course started to climb, but not super fast, but climbing. And I believe somewhere in there I had a chest CT that they did mention that I have lung mets now in every lobe of my lung. Instead of just that one we had back in 2020, now there's cancerous mets in every single lobe of my lungs, and innumerable, they use the word on the radiologists use. And generally when you have radioactive iodine resistant thyroid cancer, that's a mouthful, there's not a lot they do. It does not respond to chemo, so there's no point in giving you chemo. Before these drugs, there was nothing they did. You just, other than radiation, like palliative radiation, so you just zap a spot here and there. Now there are drugs called TKIs. They are still classified in the chemotherapy range, from what I hear, but they are, and they come like in a hazardous box material, but, and they do have a lot of side effects. They are harsh on the body, but they target the mutation and help stop it from growing. They don't work forever, but there are more and more drugs coming on the market that you can cycle through. Currently, there are no ones that target my mutation. I think there might be one in clinical trials, but none that target my mutation. But there's Lenvima, I think I'm saying that right, or lenvatinib. That drug works really well for a lot of folks, even with my mutation. But again, it doesn't work forever. So once you're at metastatic stage, there is no cure, but you can live a long time. But where's it gonna go? You're just always living with, where's it gonna go? And it never goes where it was. It doesn't go in the like double chin, doesn't go in the booty. It's gonna go, generally for follicular, it'll go to the lungs and then the bone. And it can go in the brain. I would prefer it not to go in the bone. Never broken a bone, but yeah, I don't want it in my hip, back, none of that, and that does happen. So I'm trying not for that not to happen. Currently, I'm on watch and wait, which is hard. Watch and wait is not easy. I don't know if somebody's told you. It's not, because you are always worried, where's it gonna go? If it wasn't going or moving or doing what it wants, I wouldn't worry, because well, yeah, it wouldn't be really at risk to me. But because it could move to somewhere important, that's what we don't like. So where we are now is I am basically self-referred. I did tell my team to send a referral. They did. But because of a thyroid cancer group I'm in, I forgot. That's right. Just recently, let me back up. So my tumor marker has risen May 2nd. It's currently June 1st. On May 2nd, I had a ultrasound with my endocrinologist. She does my ultrasounds in the office, and she found 2 more suspicious lymph nodes that don't have fatty hilum, so they look suspicious for a recurrence, and my tumor marker went up, so that would correlate. I have not had a neck CT since almost a year, and it's been 6 months since I've had a chest CT, so that could have grown too. But anywho, so after that happened, I'm like, okay, well, I don't want surgery again, and I don't want radiation again, because, well, lots of radiation isn't great for you. So I, and rather save that for when I really need it. So I had heard about Mayo, and a Mayo Clinic. They aren't the top for thyroid cancer. That'd be MD Anderson, and also well, there's a few like specialists out there that have done a lot of research, but they do alcohol ablations, which there are only a handful in the country that do that for thyroid cancer patients. And so an alcohol ablation would be, interventional radiologists would use ultrasound or CT guided, and then they would insert ethanol, alcohol, straight into it. It'll essentially kill off the cancer, and it can kill off some healthy cells. So there's always a downside. And it can swell real big. You can have a reaction. There's risks, but it's not as risky as going under anesthesia, getting cut open again, and also they'll be dealing with so much scar tissue after 4 surgeries. So thankfully, none of my doctors told me about that. I heard about it, and I'm like, I'm gonna pursue that. Like, you want me to sit here and wait until it just keeps getting bigger, and I'm gonna do something a little different. So, and then I also am gonna pursue, they have trials, and where they redifferentiate the cells by taking, sometimes they take an oral chemo and a TKI, or just one, and they take it for a certain amount of time, and it's supposed to help redifferentiate the cells to take up radioactive iodine again. So I want to try that to see if we can get some of those lung mets to just to go away. It will not cure me. None of this will cure me. I will not be cancer free, but it would give me just longer to not take the TKI, because the TKI has a lot of risks, and one of those that does concern me is it can cause instant high blood pressure, and your blood pressure can be really hard to manage. Well, I already have high blood pressure. I've had it since I was in my 20s. Since I was much thinner. It's definitely genetic, and it does not always cooperate with medication. So I already have trouble managing it, so then what will I do? I don't want to have a stroke, because that would be the risk. A stroke, heart attack, all that. It also, you can get sores in your mouth, on your hands and feet, diarrhea, lots of things. So it'd make working really hard. And I'm just not ready for that. And because it doesn't work forever, and I have to make it or I'm only in my early 40s, 27. And since I have so much longer to go, I don't want to start those yet. I want to wait until I can, because also thyroid cancer can get more aggressive as you go. It can mutate, and so let's save that for so we have tricks up our sleeve. Anywho, so that's my plan. Go to Mayo, and all that, and see how they can help. Right now, I've only had the nurse phone call, and we're waiting to know when my appointment date is. So I will keep you posted, but that is my story. This is a very long video, and I wonder if YouTube will let me post it. But thank you for watching. I hope you made it to the end, and you have a good day.